Hello, my name is Chang Han. I'm part of Professor Yu's research team in Yonsei University. I'm here to talk about a major evidence gap in guidelines regarding acute coronary syndrome, specifically the drugs ticagrelor and prasugrel. It goes without question that ACS is a major healthcare concern. The mainstay of therapy is procedural, achieved with percutaneous coronary intervention. However, medical treatment is also important to prevent ischemic outcomes. The cornerstone of medical treatment in ACS undergoing PCI is dual antiplatelet therapy involving aspirin and P2Y12 inhibitor. Currently, 3 oral agents are available for this drug category. Clopidogrel, prasugrel, and ticagrelor. Let's briefly compare them. Prasugrel and ticagrelor, as newer drugs, are faster and more potent inhibitors of platelet activity. Ticagrelor is the only reversible inhibitor and has to be taken twice daily. One notable unique side effect of ticagrelor includes dyspnea. I am addressing this to note that ticagrelor is likely to have more compliance issues. To compare these drugs, we have to look at their efficacy to prevent ischemic events, and safety to minimize bleeding risk, and net clinical outcomes involving the composite of both is also important. Now let's go over the evidences and guidelines currently available and how it changed over time. There were some landmark trials comparing these drugs, Plateau and Triton-TIMI-38. Triton-TIMI-38 was published in 2007, was a phase 3 double-blind trial comparing clopidogrel and prasugrel. It showed the superior efficacy of prasugrel, but this was achieved in exchange with increased bleeding. Next, Plateau was published in 2009. It was also a phase 3 double-blind trial comparing ticagrelor and clopidogrel. It showed superior efficacy of ticagrelor with comparable safety. These results were incorporated into guidelines. In the European guideline published in 2011 and 2012 recommended prasugrel or ticagrelor over clopidogrel. Now, looking at American guidelines published in 2013 and 2014, even though they didn't discretely recommend one drug over another, they did introduce the results of Plateau and Triton-TIMI-38 in their text. Now, next question was the comparison between ticagrelor and prasugrel. We have to consider that comparing these two drugs, which are already approved, there needs to be a researcher-driven phase 4 trial, unlike sponsored trials like Plateau or Triton-TIMI-38. So Prague 18 was not attended this comparison. It was published in 2016, a phase 4 open-label trial. It was unfortunately an underpowered study, largely deemed unreliable. ESA-REACT-5, published in 2019, was the next attempt. It was also a phase 4 open-label trial and was sufficiently powered, fortunately. It showed superior efficacy of prasugrel with comparable safety, which was contrary to the previous beliefs that ticagrelor was the better choice. ESA-REACT-5 raised great controversy and was criticized for its open-label design, along with other components of its methods. That is why these results were not incorporated to my American guidelines published in 2021. While it states how ticagrelor and prasugrel are preferred over clopidogrel, the results of ESA-REACT-5 is not even mentioned in the guidelines. On the other hand, the European guideline actively incorporated the results into their recommendation, which states that prasugrel should be considered in preference to ticagrelor. So now we can see where researchers can contribute to this shifting treatment landscape. The comparison of ticagrelor and prasugrel remain inconclusive with discrepancy between two major guidelines. Furthermore, the results of plateau, and by extension the merit of ticagrelor, is also being called into question. Recently, this was just a month ago, the BMJ published an investigation article and openly casted doubts over plateau study. In subgroup analysis, ticagrelor failed to show apparent superiority only in the US, where it was not monitored by the sponsor itself. In fact, we had already tackled this problem. This was an article published in JAMA 2020. We showed that ticagrelor had no clinical benefit over clopidogrel, contrary to the results of plateau. So I believe it's our time to address this controversy regarding ticagrelor versus prasugrel. I believe we can contribute by providing valuable evidence from a high-quality observation study using real-world data. Thank you for listening.